My name is Alicia Bembetic. This is going to be my head-to-toe assessment. Okay, we're going to start off this assessment by assessing the skin on the upper and lower extremities. We're looking at the color, the texture, and the temperature. Go ahead and touch it. Temperature is good. Color is good, even. We're looking for any lesions, any kind of masses, anything that stands out to us. I'm going to go ahead and I'm going to assess the lower extremities for color. Okay. And texture and temperature. They also feel good. When looking at the legs, you want to look at the hair distribution on the legs. You also want to assess for any edema, not noted, and you want to check to see if they have any varicose veins on those legs. From there, we're going to assess the fingernails. We're going to look at the color of them, the texture, if they're even. We're looking for any kind of markings underneath them. We're also assessing if they have any clubbing of the fingernails and that all the fingernails are adhered to the finger evenly. So from the fingernails, we're going to move on to assessing the head. With the head assessment, we're looking at the size, the shape of the head, the symmetry. We're looking at the texture of the hair, if it's evenly distributed. We're looking at the scalp, if there's any dryness. And then I'm going to go ahead and I am going to palpate the face, and I'm also going to palpate the scalp and the sinuses at the same time. Let me know if you have any tenderness. Okay, palpating temporal sinuses. Okay, maxillary, mandible, and tonsillar sinuses. After we assess that, we're going to assess for TMJ. So go ahead and open your jaw and close. And we're looking for any crepitus or clicking of the jaw. From the jaw, we are going to go ahead and assess we're going to go ahead and start our assessment for cranial nerves. I apologize. So cranial nerve number 5, which is the trigeminal, we're going to have the patient clench their jaw, move side to side. Okay. And then we are going to assess cranial nerve number 6, which is the facial, by having the patient smile, frown, puff your cheeks out, and make a duck face. Good. So that's cranial nerve number 5 and number 6. From there, we are going to test the oculomotor cranial nerve, which is number 3. And the cover and uncover, which is cranial nerve number 6, the abductor, and then cranial nerve number 5, which is the trochlear, by doing the twinkle test with the eyes. Okay, and then twinkle, and look straight forward. We're looking for any drifting there, no drifting noted. From there, we're going to go ahead and do the 6 cardinal gazes. Follow my finger. You can do that in an H pattern or in the star pattern. We're going to inspect the eyebrows for symmetry. We're going to look at the exterior structures of the eyes, looking at the lids, the eyelash distribution, assessing the lacrimal duct, the corneas. We're looking at the structures of the eye, the globe of the eye, assessing to make sure that they're is symmetry and all of that. We are also going to go ahead and look at the lens clarity and assess the inner eye, and that's cranial nerve number 2 and the red reflex. Okay, good red reflex. So we also want to look at the optic disc. We're looking at the size. We're looking for any hemorrhages when we're looking in the eye. We're looking at the AV vascular system of the eye. We're looking for if there's any exudate. We want to assess the conjunctivitis. We're going to palpate the lacrimal duct. Feels good. From there, we're going to move into assessing the nose. We're looking at the color and the mucosa of the nose. We're looking to make sure that the septum isn't deviated. Looks good. Go ahead and blow. Checking the patency of the nose. I'm going to have you go ahead and close your eyes. We're going to do the smell test, which is olfactory, which is cranial nerve number 1. Can you tell me what this is?
Vanilla.
It is vanilla.
It smells like grandmother's homemade cookies.
So from there, we're going to move into assessing cranial nerve number 7, which is the acoustic cranial nerve. We're going to first assess the outside of the ear. We're looking at the external structures. We're going to look at the ear, assess the ear canal. And turn your head this time. Looking for symmetry, looking for any colors, any lesions. And then we're going to go ahead and we're going to look inside. And we're looking for the cone of light. We're looking at the temporal membrane. We're looking for any redness, any exudate. We're looking at the malleus. No, looks good in there. I'm going to turn your head for me so I can look at this one. And cone of light, and looks good. And that was cranial nerve number 7, the acoustic cranial nerve. We're going to go ahead and perform a whisper test. Tell me if you can hear me.
Mm-hmm.
What did I say?
Shut.
Yep.
Little puppy.
Okay. We would also want to do the Weber test and the Rhine test. You need a tuning fork for that. For the Weber test, you place it on the center of the forehead, the vibration. And then for the Rhine test, you place it on the mandibular and vibrate it. From there, we're going to go ahead and we're going to inspect the mouth. We're looking at the lips. We're going to look at the mucosa in the mouth. We're looking at the tongue. We're looking at the palate, the teeth. We're going to go ahead and lift up your tongue for me. We're looking at Wharton's gland and the statin gland underneath the tongue. We're looking at the color. We're looking for any discoloration within the mouth. We also are looking at the uvula. Go ahead and say "ah" for me. Okay, we're assessing the uvula, and that's the hypoglossal cranial nerve, which is cranial nerve number 9. And go ahead and move your tongue back and forth. We're assessing cranial nerve number 12, and by having the patient talk and swallow and assessing their gag reflex if you need to, you're testing the vagus cranial nerve, which is cranial nerve number 8. From there, we're going to go ahead and start inspecting the neck. We're going to look at the spine. We're looking for any kind of step off or deviation in the neck. I'm going to go ahead and look at the front of your neck. I'm looking at the trachea. It appears midline. We're going to go ahead and grab my stethoscope. I'm going to listen to the carotid arteries. And we're listening for that whoosh. I'm going to go ahead and listen to your thyroid. Okay. From there, we're going to assess cranial nerve number 11, which is the accessory. And go ahead and lift up. Okay. And look right. Okay, look left.
Oh,
Look right. Okay. And from there, we're going to move into listening to the lungs. So first, we want to inspect the chest. We're going to look for equal rise and fall of the chest. We're looking on the expansion of the chest anteriorly. We want to also look at the posterior. We're looking for any masses, any lesions, any bulges on the chest, any lifts, any thrust. We assess with the cardiac area. We're going to go ahead and we're going to auscultate anterior and posteriorly, apex to apex, base to base. Deep breath in and out. In and out. Okay. Same thing on the back. In and out. In. Out. Big breath. Out. In and out. Okay. We also want to, when listening to the lungs, we want to assess if there's any crackles, if it sounds like there's any wheezes. Ask the patient if they're having any difficulty or if they've had a cold before you actually listen to their chest. So we're going to go ahead and we're going to move into the cardiac assessment. So once again, we're looking for any heaves, any thrusts. I'm going to go ahead and feel the PMI. So we're feeling for any possible murmurs. And this is the aortic valve here. From there, we're going to listen to the aortic area. And I'm hearing S1 over S2. From there, we're going to listen to the pulmonary area. And there we want to hear S1 over S2. We move into Erb's point. And S1 over S2, the tricuspid area. And then the apical mitral valve area. Which is S1 over S2. From there, we're going to palpate the temporal artery. Okay. Bilateral radial. And then the brachial. Going to move down and feel the popliteal behind the knees. You have the dorsal pedialis. I apologize, the tibial, and then the dorsalis medial is on the top of the foot. So after you assess your vascularity, you would want to move into your abdomen assessment. So I'm going to have you go ahead and lay down for me. So make sure the camera can get this. So before you touch the abdomen at all, you're going to want to assess the color. You're looking for any stretch marks. You're looking at any masses, any hernias, any bulging. You want to look at the umbilicus, the belly button. You want to see, on skinny people, you can see an aortic pulsation, but you don't want to see any massing pulsations in the abdomen. So you want to look at all that before you actually auscultate or touch the belly. So I'm going to go ahead and I'm going to listen to your belly. You're going to listen in all 4 quadrants. Okay, and he's got hyperactive ball sounds. I can hear him right away. You're hearing that tinking noise. From there, you can lightly palpate the abdomen. So you want to start with light palpation first and then move into deep palpation, as you don't want the patient to be guarded. So let me know if you have any tenderness at all. Okay, and this is the area of the colon down here, the appendix in this area. You're assessing for tenderness, any guarding, feeling for any masses. And up here, liver area. Okay, deeper palpation. And then I'm going to go ahead and I'm going to percuss the liver. You start down. You hear that tympanic, and then it moves to a dowel sound when you get to the liver. And move downward from the 10th intercostal space. Normally the liver measures about 7 centimeters. I'm going to move to the other side and I'm going to percuss the spleen. And then I'm going to palpate for the spleen. You shouldn't actually be able to palpate the spleen. If you do palpate the spleen below the 12th rib, you are possibly have a patient who has an enlarged spleen. I'm going to go ahead and I'm going to palpate the liver. Take a deep breath in and out. Okay, and you should feel the most border there of the liver. I'm going to go ahead and I'm going to palpate your kidneys. Okay, deep breath in and all the way out. Okay, now I'm going to come to the other side. Do the same. Deep breath in and all the way out. Any tenderness there?
Nope.
Okay. From there, I want to listen to the vascularity of the abdomen. So I'm going to start by listening to the renal arteries. I'm going to listen to the aortic artery. It's going to be midline, about 3 finger widths above the belly button, the umbilicus. I'm listening for any brutes, the whooshing. Okay. From there, I'm going to move down posterior of the umbilicus and about mid-clavicular line, and I'm listening to the iliac arteries. And then I'm going to go ahead and listen to the femoral arteries, bilateral, which is in the groin area. Okay, from there we're going to move into the musculoskeletal system. I'm going to have you go ahead and sit up for me, face the computer. So when assessing the musculoskeletal system, we're assessing for symmetry, we're looking at the muscle symmetry, and we're looking for the bone structure on the patient. We are looking at the joints, we're looking at the shoulders, the elbows, the wrists, the fingers, the hips, the knees, and the ankles. Also the neck and the spine. So we're going to go ahead and start with the neck. I'm going to have you look down and then look all the way back. Okay? And then I'm going to have you look bend your head side to side, lateral flexation. Okay, yep. And then a full circle all the way around. Looks good. Okay, well, we're going to test the strength of the head. Go ahead and push forward, push back. push against me, push against me. Good. So when we're testing that sternocleidoid mastoid muscle when we are testing the strength of the neck. From the neck, we're going to move into the shoulders. I'm going to have you rotate your shoulders forward. Okay, and backwards. Good. Okay, and then I'm going to have you bring your shoulders out, all the way out. Good. Now the other one. Okay, and that's abduction, and then bring them in. That's adduction. Okay, I'm going to have you put your arms all the way out. I'm going to press down on them. I want you to resist me. Okay, and we are testing the deltoids with that strength. I'm going to have you make a fist. Okay, and I'm going to pull against you. Resist me. Okay, and then I'm going to push against you. Okay, so first the biceps when I'm pulling, and then the triceps, I'm assessing those. We're going to go ahead and we're going to palpate the shoulders, assessing for any crepitus or any discomfort, tenderness when we do. So I'm going to go ahead and have you bend your elbow. Good. Okay, and then bend this one. Okay, and then I'm going to have you push your arms out with your hands up. That's supination, and then flip over, and then pronation. Good. So we tested the elbow strength when we tested the biceps and the triceps. So next we're going to move into the wrist. So I have you put your hands up, okay, and bend down, and rotation, looks good, okay, and then resist me, okay, and then press against me, okay, good. And then I'm going to go ahead and assess your fingers. Okay, go ahead and bend the joints for me and grip my hands as hard as you can. Okay, looks good. And then go ahead and try to separate your fingers. Good. Separate. Good. Okay, and then resist me. Good. Resist me. Good. Okay, from here, we're going to move into the hips. If I can have you lay down, I'll have your head that way. Lay with them completely flat. I'm going to have you bring your legs straight up towards your chest.
Both of them?
Sure. And we're assessing the hip range of motion. That's a 90 degree. Next we're going to, sorry, my back's to you, I just realized. Next we're going to assess at 120 degrees. I'm going to have you bring your knee to your chest, this side first, and then rotate out laterally, in medially. Okay. Knee to chest, out laterally, in medially. Okay, extend that leg. I'm going to have you point your toe towards your other foot. Okay, and then all the way out. Okay, and we're assessing the internal and external rotation there of the hip. Okay, point it all the way in. Yep, there you go. And point out. Good. So I'm going to have you push up against my arm. Yep, both legs. Okay, good. And then push down. Okay. And go ahead and sit up for me. I'm going to have you cross your legs. Okay, and the other way. And we are assessing the gluteal and the quadricep muscles by sitting and crossing our legs. Next, we're going to go ahead and look at the knees. I'm going to have you extend them, both of them all the way up, okay, and then flex them, okay, and then push against me, and resist me. Good. We're going to go ahead, I'm going to have you turn and put your feet up on the bench. You can bend your knees. We're going to look at the ankles. Okay. I'm going to have you push against me. That's dorsal flexation, up, push up, and push down. Okay, and then can you rotate your ankles out and in? Good, looks good. Any stiffness with that at all?
Nope, they feel great.
Okay, go ahead and sit facing the computer for me. So we're going to go ahead and we're going to assess the spine now. I'm going to have you stand up. Okay. turn to the side. There you go. So we're looking at the curvature of the spine. I'm going to have you bend back as far as you can. And then go ahead and try touching your toes.
Try.
Or touch your toes. Okay. We're assessing for any scoliosis here, looking at the curvature of the spine. So it looks good. Okay. You can go ahead and sit down. Well, actually, we're going to do heel to toe. I'm going to have you walk heel to toe, assessing your gait. And we're assessing the sensory function here. Okay, looks good. And come back and stand in front of me. And we're going to do the Romberger test. Close your eyes. You're a little bit apart. And we're just looking for that reflex there. We're going to go ahead and have you sit back down. Have you close your eyes? Can you tell me where I'm touching you?
Left.
Okay.
Right chest.
And we're assessing that light touch there. Can you tell me where I'm touching you?
Neck.
Okay.
Left wrist.
Okay. And then we're going to go ahead and assess the position sense. Go ahead, keep your eyes closed. I'm going to either lift your finger up or lift it down. Tell me what I'm doing.
Up. Down. Down. Up.
Okay, and then I'm going to assess this other hand.
Up. Up. Down. Down.
Okay. From there, you would want to assess the vibration. You would need a tuning fork to do so. You hit the tuning fork and just assess that they can feel the vibration throughout their body. You also would want to assess their reflexes. So you'd want to assess their brachial reflex, the brachial radialis reflex. You'd want to assess the patellar reflex, their bicep reflex, and then their tricep on the back, and you would assess their ankle jerk. That concludes my head to toe assessment. Thank you.